Hey everyone, welcome or welcome back to my channel. Thank you so much for clicking on this video. My name is Nurse Melissa and this is the Lucky Nurse Lectures. So in this lecture video, we are going to talk about the signs and symptoms associated with right-sided heart failure. But first, if you have not watched my videos on parts of the heart and how blood flows through it, and congestive heart failure, I do suggest that you go back and watch those videos because it'll help give you more context for this video. So I'll go ahead and put those videos in my description box below so that you can click on the link if you want to check those out. In general, understanding how blood flows through the heart really does help in understanding the differences between right-sided heart failure and left-sided heart failure. So that is the biggest advice that I can give you when you're trying to memorize the signs and symptoms associated with one versus the other. So just a very quick review. Heart failure or congestive heart failure is a condition where the heart is not able to pump enough blood into the body in order to meet the body's needs. Now, usually it's not the entire heart that's not working properly. So it's not the entire heart that is failed, at least not initially. In some cases, in many cases, it's only the right side of the heart that has an issue, or it's predominantly the right side of the heart that has an issue. And so in these cases, we call it right-sided heart failure. And when this happens, there are certain signs and symptoms that occur in right-sided heart failure that do not occur in left-sided heart failure. So for a proper definition of what right-sided heart failure is, right-sided heart failure is a condition where the right side of the heart is unable to pump blood effectively into the lungs. And so this creates a backup of blood in the right side of the heart and ultimately creates a backup of deoxygenated blood throughout the entire body. So now we're going to have a very quick review of just how blood flows through the heart and how a backup of blood flow can affect the right side of the heart. So whenever you think of heart failure, I really want you to think of the anatomy of the heart and how blood flows through it. So deoxygenated blood that has been used up by the entire body travels back into the heart through an entire process in order to become oxygenated and then to be released or be pumped throughout the body and to perfuse oxygen and oxygen-rich blood throughout the body. So on the right side of the heart, we have the right atrium, which is the first chamber of the heart. And blood travels through the superior and inferior vena cava and enters into the right atrium. And then from the right atrium, that deoxygenated blood is then pumped down into the right ventricle, which is the second chamber of the heart. Now, the next step in this process for a healthy heart would be for blood to then be pumped from the right ventricle up and into the pulmonic valve, and then the blood will enter into the lungs, and that deoxygenated blood will become oxygenated. But the problem is with right-sided heart failure, this process is halted because there's something going on with the right side of the heart that is preventing an adequate amount of blood to be pushed up and into the lungs. And so because of this, blood flow is stopped and it creates a backup of blood in the right side of the heart. So, like I said, the next step of the process of blood being pumped into the heart, once it is in the right ventricle, is for the right ventricle to pump up that blood and send that deoxygenated blood into the lungs to become oxygenated. But with right-sided heart failure, something's going on with the right side of the heart, like I said. So that something is going to prevent blood from being pumped up into the lungs. And since blood cannot be pumped up into the lungs, what ends up happening is that there's a backflow that is created inside of the right ventricle. So that blood in the right ventricle that's supposed to leave the right ventricle, it's not able to leave. So what happens is that it ends up pooling and sitting in the right ventricle. And this creates a backup inside of the entire system. So that right atrium that's supposed to pump blood into the right ventricle, since there's blood already sitting in the right ventricle was never emptied, the blood in the right atrium is not able to go down and follow the flow of blood through the heart. So then blood gets backed up also in the right atrium. So some blood does get through in most cases with right-sided heart failure, but it's not a sufficient amount, and that is the important thing to remember. Some blood is going to end up pooling in the right atrium because there's no space for it to flow into the right ventricle. And if the right atrium is not able to completely empty and blood gets backed up in the right atrium, then the superior and inferior vena cava will not be able to successfully dump blood into the right atrium. And so you can kind of guess what will happen if the superior and inferior vena cava are not able to have blood enter the right atrium. If you guess that it will create a backup in the superior and inferior vena cava, you are correct. And since the superior and inferior vena cava are carrying blood from the rest of the body, that means that the rest of the body, so the whole body, is essentially going to get backed up with blood pretty much everywhere except for the left side of the heart and in the lungs. And so this means that there's going to be blood pooling in the body. And so at the end of the day, blood is a fluid. So the body getting backed up and pooled with blood means that the body is getting backed up and it's going to be pooling with fluid. So all of the signs and symptoms associated with right-sided heart failure are going to be reflective of the body going through a fluid overload. So some of the symptoms associated with right-sided heart failure will include pretty much anything that your mind can think of when you think of the body being overloaded with too much fluid. So we're going to see edema. Fluid is going to build up everywhere, but it's going to especially build up in the extremities, so like the legs, the ankles, and the hands. And so this will cause visible swelling throughout the body, which we of course call edema. And pitting edema is extreme swelling that is so much that you can literally press on someone's swollen body or apply pressure in a certain area and it will create like a visible divot. And so that does happen with extreme right-sided heart failure. Next, we have ascites, which is where fluid will build up in the abdomen, causing abdominal distension. So a prime way to tell the difference between ascites and just regular abdominal fat is that the abdomen will be hard or firm when you palpate it. So with somebody that has a lot of abdominal fat, fat tends to be soft. So when you palpate or when you feel the stomach, when you press down, if it's just fat, it'll be able to press down. It'll be soft and squishy. With ascites, with that extra fluid pooling in the body, when you feel someone's stomach, it will feel firm. It'll feel hard. Then we have splenomegaly and hepatomegaly. So that is excess fluid in the body that's going to your organs. And when excess fluid in the body goes into the organs, it makes them abnormally enlarged. So splenomegaly is when the spleen is enlarged, and then hepatomegaly is when the liver is enlarged. We'll also see rapid weight gain. So anything more than 2 pounds in a day, like 2 to 3 pounds in a day, or 5 pounds in a week can be an indication of fluid overload, which is a symptom of right-sided heart failure. So people in right-sided heart failure, if they've been kind of a consistent 5 pounds, like maybe they're within a 5 pound to 10 pound range their whole life or their whole adult life, all of a sudden you will see them rapidly gaining 3 to 5 pounds, every day or every week. That is a sign of fluid overload, and that is a sign of right-sided heart failure because the heart's not pumping blood effectively and it's making blood pool inside of the body. Next, we have JVD, which is jugular vein distension. And this is where a large vein in the side of the neck is going to be visibly present. So normally the neck veins should not be visible when someone's just sitting down and relaxing. This primarily happens when blood is unable to flow properly and there's a backup of blood flow. So you'll see that with JVD. So hopefully this quick video gives you a better understanding of right-sided heart failure. In my next lecture video, I'm going to cover the signs and symptoms associated with left-sided heart failure. So please let me know if you have any questions or comments down below. If not, I will see you guys in my next video. Thank you for watching.